everyone. I'm Dr. Elena.
I'm Camille.
We're with Pure Pediatrics, and we took a week off from our COVID updates because they've gotten a little depressing.
A little bleak.
Feel like we can see the light at the end of the tunnel, so we're back. We did last week take some children's book readings. So if you haven't seen them, check them out. We'll be doing some more later today because it's kind of, everything else is a little bit, kind of sad and morbid, and that's something fun, and kids really like that. Plus, it turns out we like reading kids' books, so that's good. So we wanted to just touch base again. One, we have a new look in the office right here. If you also probably have this new look yourself, it's lovely. Mine's white. So the very fashionable blue, I like it. Fits well around the ears.
Yeah.
So these are all the rage, as you know. We
Quite a hot commodity as well, so cherish them.
Oh yes, please do not single use these masks by any stretch. Mine actually has my name on it because I'm kind of anal that way. Anyway, because we do reuse our masks, and then once they're kind of grimy, luckily we do have more masks, but we don't have like boxes and boxes and boxes that we don't want to be wasteful. It's really important to note these masks are more to protect the world from you than you from the world, and the current recommendation is that if you're out and about, to wear a mask, even a cloth mask that you make yourself. Trust me, Google it. A million people have already put on the internet how to make your own mask. Super easy. Some hair ties or rubber bands are all you need.
Yeah. Old t-shirts, things like that.
Yeah, make them fun and make them handkerchiefs. My daughter's asked for handkerchiefs.
Yeah.
But where we use these masks, we had a run an errand this weekend. My daughter wore a mask. I wore a mask. Our daughter, who's the freshman at the University of Georgia, is our new grocery shopper. That's her new gig. We have not used Instacart. We send her to the grocery store, but she wears gloves and masks. And it's important because we were talking about this earlier.
Right.
Yeah.
Just make sure that, you're touching the cart, you're touching all of the food and everything at the grocery store, but just make sure that you kind of keep that in mind whenever you get into your car, and take your gloves off before you get into your car, before you touch your face with, getting the mask off, take the gloves off, and then of course, wipe down your groceries whenever you get home.
Yeah, and we have hand sanitizer in our car, so we basically take the gloves off, and then opens the door, she hand sanitizes really well, and then takes the mask off. Right. And the hard part is just not touching your face, because it turns out that's everyone's favorite pastime. Yeah, especially kids. Bless their hearts. So that's how we at least wear our mask around. Now, the other thing that's different in the office, for those of you who've been here, and that number's quite small, because on purpose, the whole stay-at-home order is also, for medical offices, because you don't want a waiting room that's packed with people. So telemedicine is our best friend. We were always good at it before, and we use a HIPAA secure texting app called OMD. So luckily for us, that wasn't a huge change. I can diagnose a rash pretty easily with phone, and seeing that picture, and so still keep doing that. You're doing a great job. But we do have to see certain patients in the office, and those are what we call the urgent well visits. So those are infants, for example, a newborn, a 2-month-old, a 4-month-old, a 6-month-old, those babies they're having such a sharp rise in their growth parameters at that time. We have to make sure their head's shaved, their head's growing, their body's growing, they're gaining all the weight they need, and then we have to give them their shots and exams. So it's a really critical time. So we're doing what we call urgent well visits. Now, a 3-year-old well visit, we're gonna do that when this is all over. The camp physical, when this is all over. We're really hoping there's summer camp this year. I'm not super optimistic, but that's we'll get to that story in a minute about flattening the curve. But anyway, so those things we will get to, so don't worry. But we are still doing telemedicine visits. So say your child turned 3 and was due a 3-year-old visit, great. We still arrange it as a telemedicine visit in the morning, just like the urgent well visits we're seeing in the morning, and then the sick patients we're seeing in the afternoon. So real important distinction, we're seeing the well visits in the morning, sick we're seeing in the afternoon, and specifically the sick patients we're seeing on the roof of our parking garage. We have a lovely spot out in the hot sun. We're kind of happy the weather this week's kind of milder than last week. It got
a little warm.
But we are putting on protective personal equipment for those exams, because a lot of them have involved maybe COVID-19 testing or it turns out the symptoms in kids are just basically all the common symptoms they have for everything else. I mean, easier ones are ear pain. They probably have an ear infection, but we still may look in the ear. But still, it's hard to say, and I think because right now we had been at our peak of even people being maybe asymptomatic or spreaders, so it's better just to protect ourselves, and that way protect the patient as well from us, if that makes sense. So those, parking garage, awesome.
Yeah.
Hot. So thankful for the cool week. Now for the well visits that we do here in the morning time, when you come and you arrive, there's a lovely table set outside, and there's a big stop sign. You hand sanitize, get your hands good and clean, put on a pair of gloves that we've left for you, and a mask. Now if we've already given you a mask, we would love for you to reuse that mask and wear it and bring it back and use it again. Otherwise we're giving you a mask.
Or if you have a mask from home, that would be great if you can wear a mask, because we do obviously have a limited supply.
Yeah, like all the rest of the country when it comes to PPE. But we are having you wear gloves and a mask, and it's one parent with the child, so it's not two parents and their 4 kids. So real specifically, one parent, one child, and then myself, whoever the provider is, gown, gloves, and a mask. Once again, this look is really kind of taken over. And for now, we just have to do that until we get past, a bit of this crisis. But to that, we do see a little bit, I think, of the light at the end of the tunnel, which is good. I feel like we didn't see the light at the end of the tunnel about 2 or 3 weeks ago. So there are a few resources that I use when I look at the number of COVID cases and data. I tend to not rely on CNN or NBC News for information, because unfortunately I think it's just hard and it's a lot, and I think it's terrible. I mean, I feel like every single case I see where someone dies, I'm like, oh, I mean, it's horrible. But we also have a lot of people who die of a lot of things every day, and that's also like equally horrible. So to that end, I try to rely on hard facts and numbers. And so luckily we have some of those hard facts and numbers, and so the websites that we use, and we had put a link to this one particular tracking website before, and it's called ncov2019.live. And that's a great one because it's just the facts. It's just total number of cases divided by countries, total number of deaths, recovery.
And it updates every few seconds. I mean,
it's basically this. It was developed by this 17-year-old kid in Seattle. Obviously a brainy 17-year-old kid who will go far
smarter than us all.
Very smart kid. And it's constantly scrubbing the internet and updating those cases. So, for our family, our favorite island is Turks and Caicos, and so we kept checking to see how things were going in Turks, because we love the Islanders there. They have 9 cases, by the way, 1 death, which of course was brought in from outside of that island. But you're able to see country by country, just where things stand, and state by state. I don't recommend people look at it very often, because we know the number of cases still go up and the number of deaths go up, because we haven't quite gotten to our peak in the United States yet, and the world hasn't quite gotten to its probably global peak yet either. So keep that in mind. So to that end, these numbers are from that website currently, and we're now using whole numbers. We have enough cases, we stopped being really specific. So we're at 1.9 million cases, over 1.9 million. It'll be over 2 million tomorrow. More than 118,000 deaths. And so it lists that the global fatality rate is 7%. And one real big point to make is we don't think it's really 7%. They still think it's between 1 to 2%. And it's just some countries, for example, they weren't testing a lot of people. They were testing kind of the people who showed up in the hospital who were sick. Right? And then they had the people who never got even tested but died. For example, in Italy, they had a good number of deaths where people just died at home. Their system got so overwhelmed, which is the whole idea of flattening the curve. And I feel bad. Italy really became the poster child for how not to flatten the curve. They just unfortunately got behind themselves, and once you're behind, you're just behind. And New York's a little bit in that situation too, where they had true peaks. And so it was, really overwhelmed the system, and they weren't able to implement any of the measures that would keep the system from getting overwhelmed. And so the data gets a little skewed because they had a good number of deaths they never even made it to the hospital, so they never actually got tested even. So it made their fatality rate seem even higher than it probably is. But then they also have a population who's maybe a little bit higher risk too, meaning having multiple comorbidities like lung disease, heart disease, high blood pressure, obesity, diabetes. So it turns out that, being older and then having those comorbidities did put you at greater risk. So sometimes the population itself is even skewed because people have said, oh my gosh, Germany's done so well. And I'm like, well, technically Germany's fatality rate is 2%. And right now, so is Texas.
Yeah.
So we could argue we're very similar, that we have actually been able to flatten the curve. And some people say, well, man, we just haven't tested enough people. And it's like, oh no, but we're now looking at that death rate. And so if you test even more people and you catch even more people, our fatality rate is probably even lower, to be fair.
I think Texas has actually been fortunate because things are so widespread,
Yeah,
the
well,
greater Houston area is
we're a big,
huge.
big state.
Yeah,
Yeah, from my standpoint, when people have asked, I'm like, well, the benefit we have being in Texas and Houston, and most of you watching will be from Houston, we have the largest medical center in the world. We obviously have one of the brightest medical centers in the world and a lot of resources, at our disposal. And we have a city that doesn't rely on mass transit.
Right.
So when we really think about the United States and the spread, like New York, that's a very international city. That was a city that had a lot of international travel that hadn't been shut down yet. And those cases had been running around New York for a while before they really caught on. And so they were able to see that peak, and the fact they had mass transportation.
Right.
So places where they rely on mass transportation would, in a lot of Europe's that way. Right. France, Spain, Italy, those countries. So in the United States, same website, we're at just over 577,000 cases and over 23,000 deaths. So it lists our fatality rate as 4%. Once again, a bit skewed, and a lot of it's because the New York fatality rate seems relatively high, but once again, they think there's a ton more cases in New York than that's reported, and so it could be their true fatality rate is lower. It's just based on the number of people that they tested. So it's easy to test everyone who runs into your ER because they're really sick, but how many are you missing that were exposed to a coworker and did really well and never had the opportunity to get tested, especially when we're telling them, hey, stay home.
We're following the rules
right,
to stay home.
Don't leave. If you're feeling well enough to stay home, stay home. So we know those numbers are skewed. In Texas, we're at 13,900 and 290 deaths. So that gives us a fatality percent of 2%. And once again, the argument's being made, are they just unreporting total number of cases because we didn't have as much widespread testing? And I'm like, yeah, but that's like still a good news thing, because if we're only at 2%, which is less than the entire country, and that's less than global, that's probably a pretty good indicator. The other website, and just Germany, 2.4% fatality rate. Go Texas.
Yeah.
So the other website that I really, really like, and Bill Gates had shared this website, and I usually follow anything Bill Gates recommends, to be honest, is the IHME. That's the Institute for Health Metrics and Evaluation. So if you go to IHME, if you just Google it, it'll pop up. And what's cool about this website is it is looking at all the data and projecting when the peak date in that state will be or that country will be. And it looks at the number of resources. So it knows how many hospital beds you have, how many ICU beds you have, how many you're going to need, how many ventilators you're going to need. And so you get a good sense if you're able to, what would they say, flatten the curve so that you don't overwhelm the system. It's pretty cool. Yeah. Right now they project, based on that website, that Texas will peak on April 26th. And what's funny is that date keeps getting pushed a little bit, and that's because the curve got flattened. So there's not actually a true peak. Yeah. And even if it happened on April 26th, based on the projections, they project 66 deaths. What's interesting is California is projected to peak in 2 days at 66 deaths per day as well. So a lot of people have said, man, California did so well. Well, I would say Texas is so far right there with them. So it's almost better to follow not only peak deaths, but compare that number to your total population. So New York, their peak death rate's way higher. Theirs really doesn't look like this. But then if you think about the number of people who are very concentrated in New York City compared to other cities, then you get a little bit different sense as well. So I feel like we've done pretty well, and I feel like Texas did a really good job. Man, closing that rodeo, they closed it right in at a good time. If they hadn't closed that rodeo, I think everyone now is like, oh, things would be bad. And I feel like if they hadn't closed churches, you know, so for the, you know, I know online church is awesome actually. It turns out online almost everything is awesome.
Yeah.
Zoom meetings, you know, if we really hadn't taken those measures, you don't want to.
As a whole, I think everyone has adapted.
Yeah,
you know, I mean,
you don't want to
it sucks, but you know, you still are. You've adapted.
Right. You don't want to prove the system wrong and say, well, just, you know, let loose and everyone go run around in groups again. Even in Memorial Park, I'm a runner, and when we started this stay-at-home order, I was really dismayed because I would see runners, even runners I knew, who were still running in clumps, and it kind of
stick weight.
Yeah, you know, I kind of gave them the big handoff, which was actually the right thing to do, because the reality is it's a sacrifice on everyone's part, and that means you too.
Yeah.
So the sacrifice is everyone's making a sacrifice, and a lot of people are making economic sacrifices. You know, it's really for the greater good. So everyone can do their job. They closed the parks this weekend, and we were content to not run at Memorial Park. So now clinically, one question that's come up is, well, how are we doing in the pediatric realm when it comes to not only testing, but, you know, getting, you know, the results and how many kids have been tested and how many are positive and so forth. So Texas Children's Hospital is our largest pediatric hospital here, followed by Memorial Hermann System. And I have information from Texas Children's Hospital at least. So as of Friday, they send us a weekly report to say kind of what's going on. They also send us awesome monthly virology report to all the doctors so that we also see what the other viruses running around. By the way, the number one virus last month was called rhinovirus. That is the common cold. So it's in the enterovirus family, and it causes cold symptoms. And so they do nasal washes and nasal swabs on kids who come into their hospital system. And when the flu or RSV is negative, then it gets sent for this. And the most common thing coming out was that we were still seeing some metapneumovirus, a tiny bit of RSV, we still had a little bit of flu. But for the most part, most of those illnesses are about to just plummet because we stopped going to school.
Daycare, school.
So once you pretty much stop going to school, it turns out you also decrease the rate of strep throat, you know, all these other upper respiratory infections. So ironically, we've had less calls for sick visits because everyone's like just staying with their own germs instead of like getting exposed to everyone else's germs, and so they're like less sick in general. So yay, I mean, so that way they're having less fever and you're not worried nearly as much. So as of Friday, Texas Children's reported they had tested approximately 1,500 patients, most of them using their in-house test or using Quest. And of the 1,500 approximate, they'd only had 30 positive test results. So that is an incredibly low number. And we've had no deaths in this area in pediatrics that Texas Children's reported. So one, I think that what tells us is, wow, it's a lot of kids who've been tested who don't seem to have COVID. So then the question was, well, how are they doing in the rest of the country? And so now that it's been long enough, the CDC has been able to release their morbidity and mortality report. So they actually release a report regularly as well to tell us what's going on around the country. And they have to just gather data from all the institutions. And, you know, at first it's kind of piecemeal. Like some institutions are probably better at sending their information than others. But in general, we start to get a sense of the trend of things. So for that report, it was from February 12th to April 2nd was the time reporting period that they looked at. And during that time, they had 149,000 essentially lab confirmed US COVID cases between that time period, okay? And then, because this only went through April 2nd, and as you know, a whole lot changed after April 2nd because we were just skyrocketing. Of those, only 2,500 essentially, or 1.7% of the positive cases belong to children under 18 years. So that is a tiny percentage. That's really kind of on par with what Texas Children saw too, was of the people, you know, tested. I mean, it's like a small percentage of tests were even positive, and compared to the adults, it's like a tiny percent of those positive cases belong to children. And that's probably because one, children were being tested less, because they weren't displaying a lot of symptoms. Could be it. The median age was 11, which isn't surprising because the range was like 0 to 17 years essentially, and 11's the middle right now. Most that were over the age of 10. 15% were less than 1 year, and what we really learned from the data was that the biggest risk factors for being hospitalized were if you had a comorbidity like lung or cardiovascular disease in children, or immune compromise. So for example, say someone who's getting chemotherapy or had a bone marrow transplant or doesn't have an immune system that works very well, and then being less than 1 year old. But in general, we're seeing the same data we saw that came out of China, which is most people are having, their kids are having very mild disease, and they've only attributed 3 deaths to possibly related to COVID that are pediatric. So if we compare that 3 deaths to the United States, which had 23,000 deaths, we'll see that it's very similar, as I've said before, to what we see with something like the flu, where in the United States every year we might have 50,000 people die from the flu, but only about 150 children under 18 die from the flu. So there's always been this huge disparity, and that's what we're seeing with this too, is that there's just this huge disparity, and most of the more severely affected children will probably be under 1, have a comorbidity, and so they give some reassurance to the general population as well.
That doesn't mean they couldn't be carriers or, you
Yeah.
know.
But you know what's interesting about their data that they reported? So 9% of the kids who tested positive had a travel exposure. Okay. The other 91% all had exposure in the household or known exposure in the community, which is also really interesting. So as opposed to the kid being the first one, it's like they really kind of knew someone, either someone in their house had COVID or their friend or someone. And then now that we've done the social distancing, that number should just really dramatically fall as well. So I think the prediction will remain the same, and that our reassurance to the general population is that your children are probably fairly safe. I think that if you have any questions or concerns, definitely call your pediatrician or call your healthcare provider. We still think, the highest risk group will be those kids with lung disease, heart disease, those who are immune compromised, or those who are little bitty infants. And we're still waiting on more maternal fetal data to come out, at least in the United States. But so far that data has been pretty reassuring as well. And so that we are not seeing increased mortality, for example, in pregnant women. And so that's very reassuring. That morbidity report, so we'll send a link to that as well so that you can look for yourself. And if there's lots of numbers and lots of words, I will warn you. Because even if you, as you read it, you kind of get lost a little bit in the percentages. And anyway, so I'm just warning you. It's kind of long and has lots of numbers. And then we already mentioned that the 3 deaths so far reported in the United States are actually technically still under review to confirm that COVID was the most likely cause of their death. So that's what we have for at least the update. I think that the good news that we see is that the curve does seem to be flattening. I think the bad news is, remember the whole stay home, wash your hands.
It's going to continue.
It's going to continue for a while. I mean, if I had to predict, it's like through May. I mean, I think that's more realistic than thinking it's over at the end of April. My own personal, like if I had a crystal ball, I don't think kids will go back to school this semester at all. I do not know if summer camp will go on. If it does, it'd be at the end of the summer, not at the beginning of summer, is also my guess. Because the problem will be if we suddenly, everyone just goes back to the way life was, the cases will just resurge right back up. And we really need it not to do that, because once the cases are low enough, that's when it's really important to do all that contact tracing and figuring out, oh wait, here's a positive, so
isolate,
you know what I mean? And then the only other thing I would add is, like the rest of the world, I also am very interested in what Sweden is doing, because Sweden took a whole different approach and basically kind of told their vulnerable population to protect themselves in quarantine, and they closed colleges and up, but pretty much grade school and under, and regular restaurants and so forth, they said carry on. I think they were hoping for herd immunity. They're a little bit behind in even number of cases, And so, you know, the UK was also going to try this strategy, which didn't seem like it was working out. So I think that's the only country like left that's decided to take that approach. So we will all wait and see. I personally feel like rodeo would have been a no-go for the city and really would have made our curve look like potentially something closer to New York, because that's a very heavily attended event.
We're doing a really good job if we can just like, you know, keep it going. And I know it's not fun staying at home. My husband's been at home for a month and seen nobody but me, poor thing. But, you know, continue doing it just because we don't want to see a spike. Because I feel like we've even seen less, each week we're kind of seeing less.
Yeah,
we're testing less people.
Right, less potential, you know, people who are calling saying, I think I might have it.
Right.
So I think that's probably a pretty good reassurance for us as well, too. So if you have questions, you can leave them in the comments below. We promise to answer them. We're better at that than direct messaging, just so you know. Because every now and then I get a DM and I'm like, oh, I forgot your call. But if you have questions, obviously let us know. And look forward to our children's book reading series, because that's a lot lighter. And it turns out a lot more fun, and we do that definitely in between seeing the well and the sick, so that we can save that for then. Try as you might not to touch your face. I've only done it about 5 times this last 30 minutes. Melissa did a better job. I was kind of keeping track. And wash your hands just as much as you can. And, you know, space out around your neighbors and your running buddies, so that we get through this quicker and the kids can all go back to summer camp and go to school in the fall.
Right.
So, all right, good seeing you all, and let us know if you have any questions. Bye.